evening, everyone. So, my next topic of the video, which I'm going to discuss with you after a certain period of time, is rational drug use. And before I start my video, I want to request you that if you like my video and if it is useful and helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Hans Pharmacology Discussion. So, now I'm going to discuss with you rational drug use. Now, what is definition? In simplest words, rational use means prescribing right drug in adequate dose for a sufficient duration and appropriate to the clinical needs of the patient at lowest cost. Means we are prescribing the right drug. Means right drug means which affects the disease. The pharmacological actions of that drug are suitable for the treatment of that any particular disease. So, and it should be in adequate dose. The dose should be proper. It should not be overdose. It should not be underdose. The adequate dose in children, like in children, smaller doses are required. So in the same way, it should be adequate dose and the duration of treatment should be sufficient. Means it should be proper. It should not be less also, and it should not be more also. It should be sufficient duration, and it should be appropriate to the clinical needs of the patient, and it should meet the clinical needs of the patient, and at the lowest cost. The cost should be lowest, means it should be cost effective. It should be right drug in the adequate dose for the sufficient duration and appropriate to the clinical needs of the patient at lowest cost. That is the rational drug use. WHO, the rational use of drugs requires that patient receives medications appropriate to the clinical needs. Means if the person is suffering from hypertension, the drug should reduce the blood pressure, the systolic and diastolic blood pressure. In the same way, if the patient is suffering from type 2 diabetes mellitus, the fasting plasma glucose levels should be lowered and postprandial plasma glucose levels should be lowered. So in doses that meet their own individual requirements, their own accordingly, how much the individual is requiring the dose, that should be given in those doses, in proper doses. It should not be overdose and it should not be underdose. And for an adequate period of time, it should be given for the adequate period of time and at the lowest cost to them and their community. Means the cost should be cost effective. The drug should be at the lowest cost and to the patient as well as to the community, and should be given for an adequate period of time. It should meet the clinical needs of the patient and on individual in doses that meet their own individual requirements. This consists of correct drug. Means we're giving the drug correctly. Means we make the diagnosis of any patient, the patient suffering from any disease, we make the proper diagnosis. Then we give the appropriate drug to the patient according to the pharmacological actions of the drug and appropriate indication. The diagnosis should be made and it should be drug should be appropriate to a particular indication, and we should see the efficacy, safety, suitability for the patient and cost. Means efficacy means how much response the drug is producing, the therapeutic response in the body produced by the drug in the patient. Safety means adverse reactions should be minimum and the efficacy should be more. Suitability means the drug should be suitable, means like injectables, these are less suitable than the oral tablets. So the tolerability and suitability should be seen, and cost, it should be cost effective, means least cost, and cost is seen according to the duration of treatment of the drug. The total cost per unit is not seen. It is the total cost for the treatment of the disease during the proper duration. Then in that way we can see the cost. And appropriate dosage means oral tablet or injectable, or it should be inhalational, or it should be transdermal. The appropriate doses should be seen. Sublingual in case of glycerol rhinitis, in case of acute attack of angina. The same way, administration should be proper and duration of treatment should be proper. It should be adequate for the rational drug use. and it should have no contraindications. Correct dispensing means we are prescribing the drug, the doctor is prescribing the drug, and the pharmacist will dispense the drug properly by giving the instructions to the patient of how to take the medicine, how many times it has to be taken, what all other um, information should be kept in mind while taking the drug. Appropriate information for patients, like in hypertension, we have to see that you have to exercise properly for 30 minutes, and you should avoid alcohol and oily foods, and salty diet should be prevented. And in the diabetes mellitus, we can say you should prevent the oily foods, sugar-free diet should be taken, and you have to exercise regularly for 30 minutes daily, and smoking should be avoided. In the same way, the appropriate information to the patient should be given. Patient adherence to the treatment means how much the patient is adherent, like the extended release or sustained release tablets are taken orally once a day. So their adherence is more, their tolerance, their compliance to the treatment is more as compared to the normal tablets, which are not sustained release or extended release. They require 2 to 3 times BD or TETS dose a daily, so the compliance as a result will be affected. In short, rational use of drugs is based on rule of right. That is right drug. We are giving the right drug to the right patient. Is whatever the disease the patient is suffering, we have to give the drug according to the pharmacological action of that patient. Of that drug should be given and according to the disease of the patient. In right dosage form, we have to give this the proper dosage form, like in transdermal, or it can be sublingual, or it can be oral. If emergency conditions are in emergency conditions, we have to give parenteral, like intravenous, subcutaneous, intramuscular, or intradermal at the right cost. Cost should be less. The cost should be less. It should be cost effective with the right documentation. Means, with the proper documentation means how many times the drug has to be taken, and what are other information, other non-pharmaceutical information given to the patient. Seen criteria means safety, means a drug which should have less adverse drug reactions. Affordability means we have to look at the cost of the patient. Need means we have to see the disease of the patient, and accordingly, whatever the need is required to meet that need, we have to prescribe the drug. Efficacy means what is the maximum therapeutic response produced in the body by that drug, should always be considered. Reasons for irrational use of drugs: lack of information, means there is lack of information among the doctors, means they are lacking the information, either the GRs or SRs which are prescribing the drugs, they are having there's lack of information in them, lack of experience in them, so that can lead to irrational use of drugs. Means less studies done, or less information available. Role models means whatever the teacher or seniors are, whatever the teachers and seniors are prescribing the same drugs, the GRs, the postgraduates, or the SR senior residents, they prescribe the same drugs. So they are not looking through their own knowledge, but they're just becoming the making the uh, treatment treatment available of the seniors to the patient. Lack of diagnostic facilities means there is no proper diagnosis done of the disease, or there is lack of uncertainty of the diagnosis, and there will be the medicines for all possible causes will be given, means we are giving the broad spectrum medicines for all the possible causes, and there is their diagnostic facilities they are lacking, or uncertainty of the diseases there, so that is irrational use. Demand from the patient means, but there are some diseases which can be uh, self-limiting, means which can be treated by themselves, but the patient, they say that we have to take the medicine, only then we will be all right. So they think that they should be pilled for every ill, means for every illness they should be pilled. So they are demanding the from the doctors that I want medicine, so please prescribe me medicine even in the self-limiting diseases. Patient load, means patient load is so much, so symptomatic treatment is being done. So means a doctor sees 80 to 100 patients a day, so the doctor does not make the proper diagnosis, they make the symptomatic treatment of the patient. Promotional activities of pharmaceutical industries, means the pharmaceutical companies and industries, it promote some drugs because their cost is more, or they bribe the doctors, they give them gifts to the doctors, and they give the free living in conferences, free hotel rooms, and other things, other facilities available to the doctors. So they are making so the doctors, they are prescribing the more costly medicines, or the medicines of which are less efficacious than the other drugs, because of the promotional activities of the pharmaceutical industries. Drug promotion and exaggerated claim. They can be exaggerated claim by the companies. Means that even if the response is not so much, or the safety is not so much, or there are many precautions and warnings of that drug, they will exaggerate the claim of the drugs by the companies, and they will promote the drugs. Defective drug supply system and ineffective drug regulation. There can be defective drug supply system. Sometimes the drugs are not available, so then the drugs, other drugs have to be prescribed by the doctors. So less costly drugs are not available. The more costly drugs will be prescribed by the doctors, or more less efficacious drugs will be prescribed by the doctor, less safer drugs. So that can lead to ineffective or irrational use of the drug. Faulty and inadequate training and education of medical graduates. There can be inadequate training of the medical graduates and education that can lead to irrational use of drugs. And poor communication between health professional and patient. There can be poor communication between health professional and patient. The communication is not proper, so the doctor does not prescribe the correct medicine after making the correct diagnosis. Absolutely irrational use, and this is the injudicious use of antimicrobials like antibiotics in viral fever and diarrhea, which are not required. This injudicious use of antimicrobials can occur. And this is the absolutely irrational use. Unnecessary combinations like tinidazole and ampicillin for the treatment of diarrhea, and ibuprofen and paracetamol for the treatment of fever. These unnecessary combinations are being used. Use of drugs not related to diagnosis, means the patient, the doctors, they are giving the multivitamins, or they are giving the iron tablets, or multivitamins or tonics are given without relating to the diagnosis of the patients. So that is unnecessary drugs are being given. Incorrect route means injectables are given more in place of the oral doses. Incorrect route can be the main line, irrational use. Incorrect dosing means under and overdose, and like in pediatrics, there can be overdose of the drugs, underdose can be there. Incorrect dosing also can lead to irrational use. Incorrect duration, like in tuberculosis, the 6 month therapy has to be needed, and if the patient stops taking the medicine, that can worsen the disease of the patient before 6 months. Short term use, uh, prolong or short term use. Prolong means in case of effective, more use of the antibiotics for the GA infections or for the sore throat. Prolonged use can lead to antimicrobial resistance in the patients. Unnecessary use of expensive medicines. Some expensive medicines are available, so that can lead to unnecessary use of those medicines promoted by the drug promotional industries, that can lead to irrational use. Unsafe use of corticosteroids. Corticosteroids are having so much side effects, so there can be unsafe use of corticosteroids can lead to irrational use. Polypharmacy, like in geriatric patients, that is in elderly, there's a lot of comorbidities in these patients like hypertension, diabetes, cancer, ischemic heart disease, stroke, that can lead to polypharmacy, which in turn can lead to a lot of adverse drug reactions and drug interactions. So polypharmacy can lead to irrational use of the drug. Hazards of irrational uses, ineffective and unsafe treatment, over treatment of mild illness like in infection, in any infection like sore throat or GI infection, we over treat the disease. So that can lead to antimicrobial resistance. Inadequate treatment of serious illness like in tuberculosis, the 6 month therapy has to be given, and if they do not abide by the 6 months, that can lead to worsening of the illness. Like in cancer, if the patient does not take the chemotherapy or radiotherapy uh, regularly, that can worsen the disease. And exacerbation or prolongation of illness, there can be exacerbation or there can be prolongation of the illness that can lead to worsening of the condition of the patient. Distress and harm to the patient can be there. The cost of treatment, which will affect the economy of the um, patient, that can lead to increase in cost of treatment. Drug resistance, misuse of anti-infective drugs, that can lead to increased drug resistance, increased antimicrobial resistance. Increased adverse drug effects can be there because of irrational use, and there can be morbidity, means disease severity can be there, and mortality can be there. Death of the patient can occur, and drug dependence can occur if the uh, drugs of abuse are being taken, like cocaine, um, LSD, or any other drugs, nicotine. Steps of rational drug use. Now, what are the steps of rational drug use? First of all, we have to identify the patient problem based on symptoms and recognize the need for action. Means we have to make the proper, we have to identify the patient's problem based on symptoms, and we have to recognize the need for action. Then we have to diagnose the patient, define the diagnosis according to symptoms of the patient and problem of the patient. We have to make the diagnosis. And then we have to select the drug, the group of the drugs. We have to make a list of group of drugs for the treatment of that disease after making the diagnosis. Then we can select the drug from it, and then we can start the treatment by complete and accurate prescription. Name of the drug should be given in proper dosage form, whether it is tablet, capsule, or injection, whatever it is. The dosage form should be specified. Dosage schedule, how it has to be taken, BD, TDS, OD, or QID, or SOS, that should be written. And total duration, for how many days it has to be given. For how many days it has to be given, that should be written. The treatment has to be given. Give proper information, instruction, warnings regarding the treatment given. Means we have to give the instruction to the patient about the side effects of the drug, and we have to give the proper instructions about the dosage schedule, how many times the drug has to be taken, and the dangerous risk of stopping the drug therapy suddenly. And we have to tell the patients that if you will stop the drug suddenly, what are the dangers and what are the risks of stopping. And then we can, step 6 is monitor the treatment to check if the particular treatment has solved the patient's problems. Now we have to monitor the treatment. We are giving the treatment to the patient along with the instructions and safety measures. And then we just monitor the patient while the patient is taking the treatment, whether the treatment has solved the patient's problem or not. And there is passive monitoring and active monitoring. Passive monitoring is done by the patient itself, and explain him what to do if the treatment is not effective or it has many side effects. If the drug is having so many side effects, the patient is asked to stop the drug immediately. And if the treatment is not effective, they can give some alternatives to the patient. Active monitoring is done by the physicians when after follow-up days after treatment, when the patient comes to meet the doctor for the appointment. Now the doctor sees the response of the treatment. What is the therapeutic response of the treatment? How much condition of the patient has been improved by doing the various lab tests and other tests for studying the parameters, efficacy endpoints, and on the side effects of the drugs are to be seen, and in the same way the monitoring is done. Thank you. That's all. Kindly subscribe to my YouTube channel if this video is useful to you. And thank you. Happy learning. Be safe, be healthy, be happy. Thank you. Be blessed.